think it's a year and a half now. Is it a year and a half since the Ministry of Health put it on? It's a year.
1 year. Yeah.
1 year. And there was a lot of, like everything new that is introduced to any space, there's always curiosity and not understanding what it is. I think maybe you could start off, Joy, by just demystifying a little bit about what the Quality Rights Initiative e-learning is all about.
So basically, the Quality Rights Initiative is all about, or rather the Quality Rights Initiative as a whole is all about promoting the rights of persons with psychosocial, intellectual, and cognitive disabilities, and also improving the quality of care of mental health services. So in a nutshell, that's just what it is about. And it just helps to bring in a human rights perspective to the mental health and recovery discussion, which is quite new because most people just talk about mental health, but now this just goes a step further into adding human rights perspective into dealing with persons with psychosocial, intellectual, and cognitive disabilities.
Yeah, because I mean, for the longest time, I think we've been wired to always think mental health is either witchcraft, that it's something that is a white man's disease. And I really hate using that statement, but it's just unfortunately how it has been perceived, that mental health, when it's brought up, is a conversation that you cannot even have comfortably in a group of people, even with one person. But I think the human rights aspect is what was missing in this conversation. What has the impact been since we took up as a country this Quality Right Initiative? Because I know efforts are being put in from left, right, and center in making sure that we drive this. And that's why the Basic Needs campaign for the 5-week challenge is really, really focusing on the Quality Rights Initiative. Actually, it's part of the challenge. Remember, the 5-week challenge is a challenge. And one of the things that we're asking people to do is to take part and take the e-learning initiative and earn that certificate. What has the impact been so far? You sit in a position where you can see the reaction and the feedback, and you can see the data. How has it been received so far, let me say, on the ground?
So we've had a lot of attitude change, which was one of the main goals, because once you change people's perspectives, you're able to combat the stigma and discrimination around this whole conversation. So yes, a lot of attitude change. Very many people have embraced the course. We have over 2,000 people who have enrolled for the course, which is a great start. So we are still aiming for 50,000 Kenyans, but yeah, 2,000 is a good start. We've also gone a step further and introduced this into the various mental health facilities. And we have been able to assess 5 of the mental health facilities in Kenya. And of course, we started with Mathare, which is the National Mental Health Hospital. And, bringing this perspective into the practice, mental health practice on the ground, honestly, you can see there are some aspects that we used to do that we used to term as normal, but then you introduce this course and this whole training, and people actually get to realize, okay, so there are things that I've been doing wrong, and maybe I just customized to the current culture that was going on, but then I now need to stop that and now do things the right way. So, and I think that is a great step, because in as much as we're trying to advocate for mental health, the mental health facilities to be in tune with the same conversation. It would be pointless if we just advocate for it, but the service providers are not in line with the same conversation. So I can't say that all the service providers are like they're taking on this whole training well. And actually, at the moment, we are working on service transformation to every facility that we assess. So we have assessed Mathare, we assessed Port Trees Mental Hospital, Moi Teaching and Referral Hospital, Kisumu County, Gilgil, and we also did a community-based mental health service in Caritas in Nyeri. And all this would not have been possible if it was not for our amazing partners. We have a great team, coordinating team formed of partners from CSOs, NGOs, in the legal field. Like, it's quite a comprehensive team. So they've enabled us to do a lot. And then also we are trying to implement this into legal reforms. So trying to make, like, for example, the Mental Health Act, which is being reviewed, to align it to the Convention on the Rights of Persons with Disabilities. Because at the end of the day, we need the law also to be in line in order for some of these changes to be effected, because you're introducing new ideas such as advanced directives or having a recovery plan. And some of these things are legal, and even trying to do away with forced admission, or rather involuntary admission. So some of these things are law-based. So trying to get this embedded into law really helps progress the conversation. So we're trying to bring in a 360 degrees to this conversation, not just advocating for it, but also in the service provision sector and in law, just to cover all aspects.
I mean, your answer is very elaborate. For those who are joining us, Karibu Sana, it is our second edition of the Conversations with Eddy in regards to our campaign, the 5-week challenge by Basic Needs, Basic Rights Kenya. And we are having a conversation in regards to the Quality Rights Initiative by the World Health Organization. And of course, I had mentioned that Kenya is the second country to embrace and take up this initiative. And Joy Muhia here, she's a medical psychologist, and she also sits at the Quality Rights Secretariat. And we couldn't have anybody better to have this conversation, because she has been time it was brought into the country.
Yes, I was actually working, I was an intern in WHO, working under Michelle Funk, who's the coordinator of Quality Rights.
Yes.
So you can say once it came, like, we still were on board. So yeah.
Fantastic. I mean, who else better to talk to right now about this? Because we've been pushing this initiative online, and the whole objective of the 5-week challenge with the basic needs, and I'd like really to acknowledge Basic Needs, Basic Rights Kenya. They are the organization behind this 5-week challenge. They've been running it for the last 5 weeks in partnership with many other stakeholders, including Open Society Initiative for East Africa. Thank you to Osia for being a part of this conversation, and that's why we actually are seeing very good response from people coming in, because what they're seeing on social media is working in terms of advancing this conversation. So yeah, we're talking about quality rights. I will also be very clear. I've also taken up this training. It's amazing, and it just adds a feather to your skills in the objectives are in advancing that conversation in regards to quality rights. Now, Joy, we have quite a module on the training. Before we discuss the process of register. So sometimes we can be lazy when it comes to doing things. We are still embracing this new in doing things online. Again, as a way of making it a quality e-learning solution, you have to register. You have to start at some point to be able to gain access. Because I mean, we also want to keep some good value about this training. And maybe you could maybe just start off this bit by telling us the whole process. If I've just walked into this conversation and I hear about quality rights, where do I start from? Where do I go? Where do I log in? Do I need to pay? Do I need to do a test before I log? I mean, just demystify us this process of being able to access this e-learning training.
So the first thing is you click the link. So I'm sure most people have seen the bit.ly.
So sorry, Joy, I'll ask Ivy to put the link with the chat area, both for Facebook and Zoom. I will also see if I can get the link, and I'll just put it in the chat area so that guys can also do that as we conversate about it. Just go on, Joy.
So once you get the link, if you're a first-time user, it will open a box, and this box will take you somewhere where you can either put in your email and a password. But if you're a first-time user, so you need to click sign up. So once you click sign up, you'll get a form that will ask you to put in some of your details, name, email, and then once you put in some of these details, so it's a bit elaborate because it asks you for your country, your affiliation, your background, and then once you submit that, you're now able to create an account, and then immediately you receive an email from Corp Academy that you can now activate the account. And once you click validate, begin. Now you take back, put your email and the password that you created, and you can course. So you are returning user, you just need to put in your email and password and login. So once you log into the quality rights page, you come across the 6 modules, and so it is completely free. So you don't pay for registration, you don't pay to get the certificate. It is 100% free. So once you're in the quality rights page, or rather web page, you get access to now the 6 modules, and then you can be able to do any of them. You can start with any module. Averagely, each module lasts around 1 to 2 hours, and in total, the whole course can run up to 12 to 14 hours if you're doing it consecutively. And then, but the good thing is that it is self-paced, so it is you to decide how you want to do it, and it is so broken down, and it's short in a sense that you get short videos of 3 to 4 minute videos, and it's something that you can watch even during when you're stuck in traffic or when you're taking a lunch break. So it's something that you can do in your spare time. And then beyond that, the course is gamified in a sense that there are challenges, and then for every module you have 3 lives. That's 3 chances. So in case you fail one of the questions, you have 2 more lives, and in case you fail all 3 lives, you still have an option to restart. And then another good aspect is that you can challenge your friends. For example, now knowing that Eddie, you've done the course, I can just decide to pick one module and I challenge you. And you can not only just challenge people you know, but the good thing is that quality rights is done worldwide. Yes, in Africa, Kenya is the 2nd country, but in Europe, we have 10 countries who have already signed up and are doing it. So you have access to, you can challenge anyone anywhere in the world. And then there's a discussion forum whereby you can get to hear people's perspectives about different new aspects that have been brought in by the course, and how they are, what are the common practices in their country. So you can actually get a lot of exchange of information and ideas. And then there's also peer learning and peer coaching. And then another good thing is once you complete a module, you become a coach for that module. And then we also have badges. For every time you finish a course, you get a badge. The more you challenge people, the higher your number of stars. So we have a leaderboard. So currently, the leaderboard is being led by people from Ghana. So it is also a nice way to, challenge people and, try to get on the leaderboard. And then beyond that, I think just the fact that you can engage in all this and get a WHO certificate for free, and that this certificate is valid, you can put it in your CV or anywhere else. I think that also is, the tip of the iceberg, like the icing to the cake, that you get a certified WHO certificate for free. Yes.
Wow, amazing. I mean, I like that last point, because what we are in a world right now where our skill sets are really becoming a vital part of how we fit in into the society, especially at the workplace. And it shouldn't be used as a gadget to brag that you are now a WHO quality rights champion, but you can use it to the benefit of your workplace and your workspace. So that's why I really look at it as a very important skill set, if it's used properly, to be able to be part of this conversation. Especially, I'm looking at it really also in the family setting. It's good to be to have this kind of training in your family setting, because you really push forward the objectives of this particular initiative. Now, I'd like to jump into the 6 modules, Joy, because these are the modules that if we break it down in an easy way that people can understand, and really just, because again, it's all about the mindset in understanding where does human rights aspect come into the mental health conversation. And as I put it earlier at the beginning of this conversation, we've for a very long time, it's been thought that people with mental health challenges do not have rights. People who are suffering from depression and anxiety do not have rights. They have rights like us, like everybody else who has good mental health. And it's just that it's been lack of information, lack of awareness, and that's the gap that the Quality Rights Initiative is coming to fill in. So maybe if you, Joy, you could take us through the 6 modules. There is understanding human rights, promoting human rights in mental health, improving mental health services, environment and community inclusion, realizing recovery and the right to health in mental health services, protecting the right to legal capacity in mental health services, and creating mental health services free from coercion, violence, and abuse. And that last one is where I believe stigma sits very well there. But of course, stigma being an enemy of mental health, it's what Quality Rights is supposed to help in kicking out stigma. Just take us through the modules, Joy.
So one thing I think I forgot to mention is that another good aspect of this course is the fact that it is simplified to a point where anyone can do the course. So from a healthcare professional to a layman, like anyone who is just, even a student or a service user, a caregiver, like anyone can be able to do this course and understand. So it is simplified enough to accommodate everyone into the conversation. 6 modules. So the first one is just human rights, and this one just introduces us to the aspect of, the way health is a human right and mental health is a human right, and how the Universal Declaration of Human Rights was proclaimed in 1948 through the help of Elizabeth Roosevelt. And then it also brings in the aspect of that still human rights were still violated. So the Convention on the Rights of Persons with Disabilities came in to elaborate the Universal Declaration of Human Rights from a person with disabilities perspective. And then, so the mental health, disability and human rights course module now just talks about, discrimination and denial of human rights, disability from a human rights perspective, and then the 30 articles of the Convention on the Rights of Persons with Disabilities, and then we go on to focus on 5. So this course, if you notice, focuses on 5 main Convention on the Rights of Persons with Disability articles, or themes. So each course focuses on a specific one. So for example, now when you go on to the 3rd module, which is the right to legal capacity. So this focuses on Article 15 and 16 of the CRPD, which is about freedom from torture or cruel, inhumane, or degrading treatment or punishment, and freedom from exploitation, violence, and abuse. So this, in this module is where we get to talk about supported decision making, whereby we're moving away from where the medic is the one who makes the decision, all the decisions for the service user, but we want now it to be individualized, whereby the recovery plan is made together with the service user in a point whereby they are able to say that I want this and this treatment, that this is what I like to be done to me, and instead of just every time the person becomes violent, they're just sedated. So we're moving away from that to a point whereby the service user can be able to mention that in a point where I'm not able even to make my decisions, I want so and so to help me in making decisions at that time. So in a crisis situation, that person can be called up to assist. And you see, it removes the medical model whereby it's the doctor who knows everything, to more of social model whereby we can work together, understand what I need, and working together with the medical professionals, we can create a plan that will be beneficial to me and not just for what the doctor thinks I need. So also it goes on to informed consent, whereby most people have said that they have either many things have been done to them in treatment, which they did not necessarily approve of. So we want to bring in informed consent, whereby just explain to the service user that this is the procedure, these are the effects, these are what are the positive aspects about it. And if they're not in a position to make a decision, just as long you inform them, and then the person they chose who will represent them can also come in to help in this. And then also we have recovery plans, which we are aiming for them to be individualized. That your recovery journey may be very different from my recovery journey, and we don't have to generalize it. We need to
there's no one size fit all.
Yes, yes, there's no one size fits all. Exactly. So is once I come, understand my needs, and then let's come together and find out what is this that I need in order for me to get to the recovery process, because recovery is not a destination, it's a journey. So what is this that I need in my recovery journey for me to be able to be better? And because most of the times we realize that for one gets a bit violent, they're either detained or sedated, and actually research has shown that that causes more harm than good. So when we are able that even if I get well and then I happen to have a relapse, we will have already come up with an advanced directive which will detail that the next time I come, maybe this medication did not work well for me, I did not want this, and then I want this and this treatment, so that when I come back in a crisis situation, we already know what to do, that it will not end up me suing the institution for I was treated badly. Or we have so many cases where people end up with trauma from their experience, and then it also removes away that aspect whereby even the family members get to bring in the person chained up and or tied in ropes, because the family is also involved in this recovery journey. So they will be able to know what to do the next time you're in a crisis, as opposed to, amekuwa mwendazimu tena, tunamfunga na ropes to take them to the hospital. So we're trying to move away from that, because even that is traumatizing, to be honest. Yes. So at least now the family is able to know that, yes, now they can even identify the signs and symptoms, and even the person themselves, they can be able to identify, because they say you can actually be able to tell when you're getting to a certain point. So this helps in knowing, understanding yourself, and also understanding that, okay, so at this level I am getting to a different point and I need to now seek medication, or I need to seek treatment. And in seeking this treatment, there's a recovery plan in place, and I don't have to worry that, what will they do to me when I'm not aware. And then now the next thing is violence and ending coercion and violence. And so this is based on the article 15 and 16. And sorry, the third one for right to legal capacity was Article 12 and 14, which is exercising legal capacity and the right to personal liberty. And then now in this module for ending violence, coercion, and abuse, so it just talks about, so what does the CRPD say about violence, coercion, and abuse, and what are the impacts of violence, coercion, and abuse, and how do we understand the power relations, and also the key strategies to avoid and diffuse this conflicting situations. So most of the times, these people are trying to communicate a message, and all you need to do is understand, listen to what they're trying to say, and then try and communicate. Like, we can diffuse the situation by using de-escalating techniques. You just don't have to rush into sedating or locking them up in the rooms that they're in an isolation room, which mostly we've come to see most of these isolation rooms are very inhumane, in a sense whereby there's just four-walled room, a very small space, probably no window, and then and if people end up spending that room, there's no mattress, no nothing. So honestly it's very inhumane to say the least. So we're trying to get what are these ways that we can use to de-escalate this situation when it arises. And so it comes up with communication techniques, and then using supportive environment, because the environment plays a big role in recovery. So create a supportive environment, it will honestly play a crucial role in this recovery journey. And then the individualized here, they come into play, because when we're making the individualized plans, it is not just, as I said, it's not just a healthcare professional who's committing to it. It's my plan, right? It's me who knows, I acknowledge that this plan has been considered based on what I believe is beneficial to me, and what the doctor also believes will help in this journey. And so it being from both sides, I'm able to commit to it, and it's something that I will also do my best to achieve, because at the same time, I admit that it is what will be best for me. Whereas opposed to whereby it's more of a medic who told me that this is what I need to do, I may not really want to do it because I may not believe that's what I want, so I may rebel from it. But knowing that the doctor sat with me and we discussed, and that, it brings in the buy-in of the service user, and you get to see that there'll be a lot of cooperation on the same. And then just what are the ways that we can stop use of violence. The good thing about this course is, so these are some of the questions that have been asked, like what do we do to, before, because before you'd go to a hospital and you tell them you need to get rid of isolation rooms, but the question would be, so what do we do in place of that? Because you can't just stop. You need to give me an alternative. So it also gives alternatives, like creating comfort rooms, which at the beginning,
changing them from isolation rooms to comfort rooms. How we label things has an impact on how we understand that. So isolation room, anytime you mention isolation, even to somebody who has good mental health, when you say isolation room, it really, and considering right now we are living in times where we have to be isolated for, of course, good reasons to protect ourselves from this pandemic. But in the mental health space, isolation room, changing it to comfort rooms definitely has positive impact, eh?
Exactly. So you see, also able, some of these aspects whereby most of the challenges we've had is people say, don't do this, don't do this, don't do this. But the question is, so what are you giving us in, like, because we understand that there is a burden whereby we have very few mental health professionals. So we understand that some of the reasons why that option of an isolation room is used is because maybe the nurse may be alone amidst 100 patients and may not know what to do. But now when you bring a solution, and not just one solution, there is the comfort rooms, the recovery plans, which are individualized, like just involving the service user in the whole journey, you get to see improvements. And then moving on to the next module of recovery, quality services and community inclusion. So this covers Article 19 of the Convention on the Rights of Persons with Disabilities. And it's all about living independently and being included in the community. So once these people recover, we have discovered that it's there's a lot of stigma, so much that they're not being accepted back into the community. So we are trying to get, so what are these ways that we can involve them in the community? Like they can be allowed to vote, they can be allowed, to have a family, and it is not a problem. And the reason I said some of these things are law-based is because right now, according to law, having a mental condition is a legal ground for divorce. So these are just some of the aspects. So how can we enable this person to have access to a wide range of support and services to enable them to live and be included and participate in their chosen community? And then also this brings out the aspect of availability of community-based mental health services. So we are moving away from institutionalization into the community. So much so that once I am well, I can still live well in the community and I have a support system. So it can be from peer support, from fellow techniques to do the same. So there is a creation of clubhouses where people go for the day and they engage in various activities, and then at the end of the day they go back, to the home. So there are very many ways in which we can create a community that is welcoming and everyone understands. For example, I know in the workplace when someone develops mental health, there's a stigma, and then there are people who have lost their jobs as a result of that. And we're trying to tell them that, yes, like one can recover. So when I may be down today, but tomorrow I'll be back well, and I don't need to lose my job because of that. As long as I've accepted, first of all, that I do have this mental health condition, and I have committed to recovery, and this is my plan of recovery, which is developed in consultation with the doctors, and then I have a supportive environment at home. I will be able to cope, and I'll be able to go about life normally. So I don't need to be segregated from the society based on just a diagnosis. So that's why we're trying to get them included in the community. And the biggest challenge to this is the people in the community. So I think another good reason for this course is that it enlightens not just the service users, because the service users definitely know the type of challenges they go through, but even the family members now get to know, okay, now this is how I can go about this situation when it arises. Like other people, they get to know. And one way to deal with ignorance or lack of knowledge is giving them the information. So this course provides that information. And then for the course on mental health well-being, and for the module on mental health well-being and recovery, so this just brings about, so what is recovery and how can we promote the right to health in our mental health and social services, and then what is recovery, and then how to promote recovery, and the role of practitioners in mental health and social services in promoting this recovery. So what are these ways, like we all have a role to play to promote the rights of persons with disabilities. And me and you as people in the society, there are aspects that, or rather there are things we can do that will stigmatize a person. So what are these things that we need to stop doing? For example, labeling. And if one thing you'll notice is that this course brings in new terminology. So for example, we don't call them patients, we call them service users. It's not people who are mentally ill, it's persons with psychosocial, intellectual, and cognitive disabilities. So some of this terminology helps to break down the stigma, because there's a lot of negative, for example, in Swahili, some of the terminology we use to call people with mental conditions is not necessarily good, because like cheesy, and the moment you say the word cheesy, the first thing that comes to people's minds is something negative. But what if, one of the ways we're thinking of dealing with stigma is, changing the terminology so it removes the labeling aspect of this whole thing. So that's just a summary of the course. I hope I have gone through all of them.
Yeah, I know, and I know you've really done your best to really package it in a way that it can be understood. And it's good to see there's good feedback actually coming back, Joy, on the chat area. And I like one here from let me see. That is Julian Onyango. Julian, good to see you back. Asante sana kwa kurudi bwana. And he says, thanks, Joy and Eddie. This conversation makes the course more easily digestible. Because I think for anybody who hears that you need to log into an e-learning, first of all, they can't comprehend. But that's why we're having this challenge. That's why we're having this tour of a 5-week challenge tour, so that we can demystify, break down this whole aspect of quality rights, because it's a very important aspect. And to all the participants, as you've heard, this is a very, very important course. And you don't have to be a professional in the mental health space. Even for your family, just take one for your family. Take up the course, because you'll be doing so much good service for the family, for your staff at work, even if you're the boss, the owner of your company. Take it up, or identify individuals who you could encourage to take up that course. And you never know that impact that it will have going to serve what its objectives are for the quality rights. Now, Joy, I'd like to quickly jump into, we don't have, time has really gone, and I really wish, again, we have more time, but now I'd like now to move to the conversations with the participants. I can see quite a number of questions coming through, and I'll just randomly pick the questions. Let's see, let's start off with, there's a very interesting one I saw here from Crystal Crescent. Crystal Crescent would like to know what exactly that means. Okay, I think she was typing in the question while you were talking. Does it mean you can divorce someone because they have a mental illness? I see Sherry has given a response here, but let's also hear from Joy. So does it mean you can divorce someone? It's a very interesting question, because they have a mental illness.
Yes, so currently the law supports divorce based on a spouse's mental health conditions. So yes, you can go and say that the reason I'm divorcing is, and it is grounds legally for divorce. So yes.
That's interesting. I mean, I think it's even broken down more in the course itself, if I'm not wrong, sort of to make people understand, because it's a very sensitive issue. But if you'd like to know a little bit more about it, you can go into it. And I like what Sherry also answered. She answered in the affirmative. Yes, Crystal, this is from Sherry. I think once a spouse sees they can't handle such a situation from the other, then it is enough to be granted a divorce, like any other reasons that warrants a divorce. I can see a question here from Julian. Julian Mauliza, do we have doctors taking up this course? Very important. Do you have doctors taking up this e-learning course?
Yes, so this course has been taken up by everyone. And as you said, so one of the main things they're trying to do is to get medics to be able to get CPD points, which are continuous professional development points. So once you introduce this, it will be like a mandatory part of their training that they need to undertake this quality rights course, and not just doctors, but even the medical students who are studying. So we're trying to get it introduced into the curriculum, either as a common course or, you know, in order to get everyone who will be handling patients in a hospital, or even service users, everyone who will be handling them has this knowledge so that they are aware of what they need to do.
Okay, Joy, I'll still continue looking at the comments, questions, and feedback coming through. Naona kuna mafans hapa, mafans kibao for Joy. Jackie says, this beautiful lady, Joy, ensured WHO brought the Quality Rights Initiative to Kenya. Wow, okay. So we are talking with somebody who's, my fellow participants, we're talking with a very serious person here. She was part of a team that worked towards seeing that WHO brings this quality initiative. And you clearly see the importance of this training. Some other comments I can see here. Edwin Motura, we are here ready to learn. Fantastic. Awesome conversation for a Saturday. Well done, Edwin Motura. Nashukuru sana. Also, from Edwin Motura, this is a question to you, Joy.
Yeah.
Thank you for dissecting this course. I hope everyone who is yet to do it gets to, and more so, apply it for their day-to-day lives, which is the really interesting bit about this course. And the way it's been packaged, it's not a sit down and just answer questions and go. As you heard from Joy, it is very interactive, very interesting. And it's not only up to when you finish that course, it's also after, because you can even challenge somebody in Ghana and sort of keep that skill and the lessons that you've learned in that period you've taken up the e-learning alive and also active in yourself and of course in your life. So it's very interactive. This is from Jackie to everyone. Family support is key in the recovery process. I think she's just complimenting what you just shared with us. That's okay, I've already read that question. Crystal Crescent, thank you very much. She says, thanks for all this. And from Vitalis, Vitalis says, I think even most of our healthcare workers don't have de-escalating techniques and proper communication skills when it comes to mental illnesses. They normally rush to sedative drugs while the patient is still strangled. Wow, strangled. Heavy one. Much need to be done. What do you think about that, Joan?
So yes, as I said, that's why we are assessing the facilities and getting not just the medics to know about it, and then also with the assessments, so it's not a hit and run kind of assessment. So with these assessments, what we do is it follows the course. So the 5 main key aspects of the Convention of the Rights of Persons with Disabilities. So we're able to assess what type of environment are the services are subjected to in that facility. Is it conducive? Is it something that you would do that is norm to our culture? For example, is the food just kept somewhere in a corner, or do they get to eat in a proper environment? Or are the beds, you know, habitable, or is it, as in, are the conditions they're living in humane? And then we also go into basically all the key, the 5 aspects. We like, there's a checklist, we cross-check. And then at the end of it, we score. And then once we score, we go back to the facility and we sit down with the management and we tell them, so this is this and this and this is what you're doing, and this is what is the recommended. So what steps are you willing to take in order to reach the recommended? And so we map out a plan, a transformation plan, whereby they commit to certain aspects in order to get to, you know, the desired. And then after a period of time, we're supposed to go back and see, so last time you were at a certain point, and so how many steps have you made to reaching the desired goal? So I believe this will help in transforming the current services that are having. And we've started, of course, with the government facilities. So because you need, once they are following the recommended guidelines, it's easy now for the private facilities to follow the same.
So fantastic. I'll still go on with there's somebody here is not very happy. Sherry, I think it was a question about how this divorce now and in correlation to mental health, and Her question is, okay, I think it's just a remark. What happened to in health and sickness? That vow you take
Yeah.
and you get married. Unfortunately, then again, because now the law now comes into play there, right? Because it's part of the law now.
Exactly.
Okay. Jackie replies to Julian, even doctors are taking up the course. Smith says that there's a case study of a person wanting to commit suicide, or rather to die by suicide. I don't understand an application point when she refused a treatment. You just let her off. Okay, I don't know if it's a remark or it's just, I don't know if you can see that question there.
Yes,
Yeah,
I can see.
correct.
So no, we don't. I think that's one of the aspects that people don't understand. I know when we say letting go of involuntary admission, or if the person does not want treatment, we're not saying you let them go. You're saying that if they may not be able to listen to the medic, there's a supported decision maker that they chose. That this person is someone that they are able to, like, they understand that if anyone is willing to help me, it's this person. So it's easier now to reach out to this person to help explain to the service user that at this point, this and this is what you need. So whereas before, you see, yes, it is when you're moving away from the forced where the medic, the doctor signs it off and it's done. And once you move away from that, you need to get ways in order to help these people, because we understand that when they are in a crisis, they may not be able to make the right decisions. And that is why there is the person who is the supported decision maker who will be able to help, explain to this person and enable them to understand. And if not, this person can actually stand in the gap, because it's not a doctor chosen person. It's I chose this person because I believe that they will act in my best interest when I'm not at my best. So we're not letting them go and saying that they've refused medication, no, let them go. No, because that would be creating another crisis. That's why it's a recovery journey, and we're involving more than one person to help in this process. And beyond that, there's the peer support. So they can also get, from various, they'll be put in a peer support group. So, hearing from other people who've been in the same situation, the way it is able to reach to you. So we are not saying that, oh no, they've refused treatment, let them go. We are providing options of, we won't force you into it, but take a look at so-and-so who went through the same scenario, and this is how they went through it, and this is how it was beneficial. And hearing it from someone who was in the same scenario is able to reach out. Yeah, so we're just providing alternatives. We're not letting them go.
Fantastic. Great answer there, Joy. I'll just keep on reading what I'm seeing here. Joy, I really love this. I love the change in names from isolation to comfort rooms, from mental illness to service users or people with intellectual and cognitive disabilities. Very important to be able to move forward this conversation. That was from Joy. From Crystal Crescent, I also particularly liked how the principles can be applied across most human rights issues. It helped me see things differently and understand how we can deny people their rights unknowingly. And then let's see, I really love the course, and these are corresponding. I think these are people who've already done the course. And for those who do not know, the Quality Rights Initiative Secretariat in Kenya is looking at, you're targeting 2,000 people to have done the course by the end of this year. Is that the case?
No, 50,000 is our target.
Oh, 50,000 by what time? By what period?
So we had a 3-year period, so we've already finished 1 year. So in 2 years, you're targeting 50,000.
How many have done so far? The course?
2,000.
2,000. It's still, because if you break down each of the 2,000, how many other people or groups they're impacting, it still has an impact. So you can imagine by the time we hit 50,000, it will be quite an achievement, really the achievement and hitting the target. Guys, I know the time has run out, and I'll just quickly read more comments here. I think a lot of them are comments. And I'm a this is from, Ray Culture, you're back. Welcome back. I'm a pharmacist in training, and the course is really interesting. You get to learn a lot. Nish Kamau, good to see you back. I love the presentation. Asante sana. And then Julian Onyango, of course, sharing with us his thoughts. We need to intensify behavior and social change communication around mental health issues to make all this great content easily consumable for communities, especially on addressing stigma. And I think that is one of the challenges the Secretariat might be having in terms of breaking down this initiative to get down to the ground, to get down to the mashinani. And maybe you could make this, maybe just as your final comments just before we wrap up. What are the strides being taken, or how are you going down to the mashinani? Because again, access to online or smartphones or laptops or internet in that case is to some level it is challenging for some people, especially in the mashinani. Are there any programs or campaigns you're putting to bring it down there to that level, like Julian is sharing with us?
Yes, so one of the best things is that this initiative is currently being run by the Division of Mental Health in the Ministry of Health, which is led by Dr. Njuguna, and Jacqueline is actually the national coordinator of quality rights. So being a government-led initiative, we are able to reach so many people. And beyond that, as I mentioned at the start, that we have a wide range of coordinating committee members. So as part of the members, we have a member from the Department of Social Protection, and through them, we are able to reach, we have social protection officers in the various counties. So we're able to use that route to de-escalate, to take the cause to the ground. And then also using the various networks of all our coordinating committee members. So that's one strategy. Another aspect we do is we train a trainer of trainers. And then they are able now to take this course you train, if you're already a trainer of trainer, you can be able to train others in the community. And so we've also trained a couple of community health volunteers. And then we also have champions. And for example, Eddy is one of the quality rights champions, and we have around 7 quality rights champions who are able, to help in disseminating this information to various levels. So we have, in our champions range, we have a champion who's able to reach, the politicians and the political space. We have a champion who's able to reach the business space, just trying to get this conversation outside from the cocoon of just, people who are mental health experts or are interested in mental health, to expounding it, because mental health affects everyone. So it's not discriminate from it. They say 1 in 4, it can be anyone. So we're trying to get it away from just the mental health space into all the spaces, so that everyone can have this information and they can be able to know how, to deal with persons in that state. And so we have various techniques to reach down to the community. And also currently we have 60 trainer of trainers, and these are people who are from various organizations, various facilities are represented, various mental health services. So with this, we are able to reach to, the different people who we are hoping to, get to reach, so that it can reach everyone.
All right, fantastic. Joy Muhia, a medical psychologist, and also she sits at the Quality Rights Secretariat here in Kenya, and she is part of the amazing and very loud voices in pushing the access to this quality rights initiative, which has been put together by the World Health Organization. On behalf of all the participants, Joy, I'd like to say thank you. Very informative. You could tell by the feedback. The whole challenge has been, how do we make this easy to be digested or to be able to be understood? But I guess for all those who've participated in this, for those who've done the course and are here with us, and those who have not done the course, you've really just gotten a first-hand experience to what this QR initiative is all about. For those who are wondering how to go about it, I've posted the link to the e-learning course. It's actually the last link, comment down there. Please go to that link, and it will guide you through. Joy took you through the journey of registering and what it's all about, the interesting videos, the interactiveness of the training, so that we can be part of this community that is embracing the quality rights initiative, especially in regards to the human rights to all of us and our mental health. So thank you so much. As always, we always like having a group photo, but this is a virtual group photo, si kama zile picha za wedding hapo baada ya service. Ndaomba nyote mfungue video zenyu. Please just put on your videos for a moment so that we can have this group photo. We do this for si ati Ivy anatengeneza album. This is for us to acknowledge you for finding time to be with us, and for those who've been hiding behind the screens, we can now see the faces to the names. So kindly just put on your videos so that we can have this group photo. Thank everybody who's here. There's Becky, there's Duff, Karibu Sana, Endrono, SK, Crystal, Crescent, Dennis, Nish Kamau, Vitalis, Julian Onyango. Once again, good to have you back here for today's session. Martha Otieno, Karibu, Cynthia Mugabe, Smith. Sasa ulitoka kwa mtu ukienda kwa nyumba ndani sasa. Na tulielewana uko outdoor kabisa. David, Sherry, Jackie, Jackie, good to see you. Wange, we have King Jaffa, Valeria Nyambura, Sharon I can't see the full name. Okay. Valeria Nyambura, there's Sharon, DW, then we have, who else have I not? Vitalis mentioned, Reila Mongare, Whitney Moshira, Ray Culture Health, good to have you back. Charity Kiki, Bernard Ngeno, Purity, and Joy, Florence, Jerry, Sherry, wewe nimekutaja pia, nani mwingine sijataja? Becky, good to see you. Finally umeasha camera. So I think we are good to go. Ivy, wewe ndio utasema cheese ama ngoje tu? Tufanye nini to smile? Ivy?
Yes, you can smile, you can wave.
King Jaffa is in the dark. I don't know kama ni tokens ama ni napenda giza.
But I've taken a couple.
Okay, sawa.
Bado, goja. Nice. Now everyone I can see.
Goja.
Okay, everyone smile.
Ricardo ameenda, sijui ameenda wapi. Ricardo, okay. Ricardo has found a good place to. Aya. You good to go? Dennis Narono, amupendi sura zenyu. Oh, Sharon Nyamo, karibu sana Sharon. And Cynthia Mugabe, okay. Who else is with us? Karibuni nyote. Ivy, we are good and ready, I think.
Just one more. And I think there's a question also, Eddie, you can answer. There's somebody who's sent.
Okay. Where is the link? I'm in Botswana. Botswana, welcome. Wow, Ivy. Good stuff, eh?
Hey.
Joy, we have a guest from Botswana. I thought you should know. Yeah. I'm in Botswana, interested, but I'm late. Looks like I missed. Yes, you missed quite a lot, but we have this every Saturday, and all we've been talking about is the Quality Rights Initiative e-learning course, which is an amazing course for anybody who is passionate about mental health conversation, and anybody who feels they would like to play a part in this conversation. So that is Charity Kiki. I've posted the link once again down there, Charity. So I hope you can get it. It's on the chat area. Ivy, when you're ready, Ivy.
Okay. That's okay. We are done. We've taken at least a couple of photos. Okay. And also, the people who've joined us late, the video is currently available. We're also live on Facebook, so it's gonna be available on Facebook. And also, we'll be sharing this recording on our YouTube that will be available tomorrow. So if you've missed it, you can just go check it out and watch and see what you've missed. Thank you.
Okay, for you to do that, you need just to go to Basic Needs, Basic Rights Kenya on all platforms. Basic Needs, Basic Rights Kenya. That's where you'll find the video for today and the video for last Saturday. Until next time, Joy, asante sana. You've also opened up my mind in many ways, and everybody else here. Have yourselves a fantastic weekend and stay safe. See you next Saturday. Kwaheri.
Okay.
Bye.
Bye.
Bye, everyone.
Jafi, endo lali.
Kwenda huko Jaffa.
Endo lali.
Kwenda huko mambo.
Poa sana.
We, tutaongea.
Sawa.
This is where you click the red button, leave.
Leave. Sawa.
Thank you so much.
Thank you.
Rebecca.
Ivy.
Hi sweet.
Hi. Lunch iko wapi? Lunch iko wapi?
Hey, let's piki lunch.
Kwa nini na venye napendanga hiyo chakula yako?
You have a good afternoon. And we'll share our live. Go repost our live. Go comment what you have learned today.
Okay.
Kwaheri.
It's all right. Good afternoon.
Smith anakuanga unique.
Guys, I'm trying to kuendelea with the afternoon and you guys are still young.
It's all right. Good afternoon.
Bye.
Bye.
Ivy, check WhatsApp. Ivy. Check WhatsApp. Good. Okay. Wow. That has really been good. Excellent. Siwaski, you're on mute.
Nasema Joy anajua vitu zake.
Yes.
She is.
I'm telling you.
She knows her thing.
I've never really thought about even Nini the way she has explained it. We learn every day. In as much as I have been trained.
It is bigger. I think once unaelewa, unakuja una find out it is big. There's so much more to it, and there's a reason.
Yes.
There's a full part of the quality rights course, you know.
Yes.
Angalau.
Very. Nini hata pia nyinyi mumelan, sindio?
Mimi nakwambia hata nimesema tuko tuna discuss hata na brand tunasema I think I need to watch her recording. The recording again.
Yes.
Ameongea so hata I don't think hizo 30 minutes were enough for her.
Yes, because there's a lot like the QR, the quality rights training is a whole lot. It has sections for doctors, it has for the grassroots people, it has for caregivers, it has for the patient, yeye mwenyewe, service user, it is a wide lot. That's why we're really pushing for people to take up this training.
Actually, I really liked what even Eddy said. Eddy alisema, it is even, sometimes you also, you can also take it selfishly. Like it gives you a niche for, you know, like at the end of the day on your CV, you can say, I've taken the certificate, you have it on record. So it kind of gives you an also. And especially if you're applying.
Yes, actually, that's why I'm telling you, you are targeting university students. Why? University students, most of them unakuta mtu amemaliza na hakuna kitu amekuwa anafanya. But by the time you graduate and you have a QR course, that is an experience on its own. You won't start from a point of zero. It is adding up to what you already have. You're not starting, like you, when you graduate with the other students, you won't be at par. You will be way ahead. Like the people who are already in this program and they are volunteering, they're already starting to get the experience of mental health. So by the time they graduate 2 years down, they have 2 years experience.
Yeah.
by the they are competing at very, very different levels.
Yeah, it's very, very.
Yeah, I liked that so much. And I like what you said. So we can put the recording we did last Saturday and this one, and then now we have it on YouTube.
Yes.
Wow, that is nice.
I like
so that can actually
be. Speaking of YouTube, but I want to ask Eddie. Me nona tusifanye Zoom next time. Let's do it as a YouTube live. I know, unfortunately, you won't have the audience that we are on Zoom, but it's going to push the Zoom, it's going to push the YouTube page. Afanye YouTube live and Facebook.
But I think we can still do YouTube, but also no, I mean we can still do we can still do Zoom, and ama nifiche hii na kidole yangu. We can still do Zoom. We can still do Zoom, but we do Zoom, but then now sasa si tukiweka kwa YouTube, it will even attract, you put it as a new nini, and then it will even attract views.
I know,
just like what you are suggesting.
But unaona hiyo ni after. Ebu sema what we were discussing. Explain me, Rebecca.
We do a Zoom and we stream it on YouTube. We do like what we've done now.
Oh, we stream it on YouTube. See, yes. Afanye from YouTube instead. Oh, because I thought that's what you meant. To discuss.
Because it's a discussion.
If then like the way you can stream, we can still stream on Facebook and still stream on YouTube.
No, okay. Right now we have like our capabilities is we can only stream
on Facebook
on one platform at a time. So next time we stream on YouTube, but via Zoom.
Via Zoom on YouTube.
So I have activated the live stream on YouTube. It takes 24 hours for them to approve it. So say
by tomorrow we'll know if that's possible.
We'll test.
We'll test it.
It's fine. With technology is always it's developing, and it is good to try.
Yeah,
I like do you know? Sorry?
Oh, nasema, so at least now we can bring an audience from Facebook, IG, wakuje sasa YouTube.
Yes.
So and especially now for Facebook, it will be a good thing to progress the page.
And I know even when we do it on YouTube, we can still share it on Facebook.
Yeah. And Instagram.
Yes. And I like that idea of now the recordings that we have done, if you put them on YouTube. I realized something today. As the recording was starting, I know